The pandemic and, of course, protests across the United States have both highlighted how sharp income inequality has become in the United States, especially for those in the working class who can't telecommute to their jobs.
Authors Ann Case and Angus Deaton, they charted in their book Debts of Despair in the Future of Capitalism, the Economic and Social Forces that Make Life Harder for Working Class Americans. And along with the rise in so-called debts of despair from alcoholism, suicide, and drug overdose. So Ann is a professor emeritus of economics and public affairs at Princeton University, and Angus is a professor of economics and international affairs also at Princeton. Thank you both so much for joining us. We really appreciate it.
It's a pleasure to be with you.
Absolutely. Ann, let's begin with you. Tell us a little about why you decided to write the book. What was it about the data and some of the things that you were seeing that you wanted to crystallize into what has now become a term in the cultural lexicon?
Well, we started this work about 5 years ago, and we realized that mortality in midlife for working class whites was rising. And that came as stunning news to almost everybody. And as we dug, we realized that the causes of death that were rising were these three: drugs, alcohol, suicide. And we couldn't stop digging there. We had to go further and try to figure out, why has this happened? What is going on here? And so the book documents both the despair and the underlying forces that we think have been at work for the last 40 years.
Mm-hmm. Yeah, and Angus, just lay that out a little bit more. What are some of the new findings here that help readers and help citizens in this country and policymakers to understand what exactly is going on?
Well, I think the key thing that surprised us most and runs right through the book is that bad things, including mortality, but much more than that, are happening not to all Americans, or not even to all white Americans, but to white Americans without a BA. And so something's happening to less educated people that's not happening to people who have a four-year college degree. So the 2/3 of Americans without a four-year college degree have not only seen this rise in mortality, the rise in suicides and drug overdoses and alcoholic liver disease, but their marriages have been coming apart. They're less likely to be in the labor market than they used to be. Their real wages have gone down over time. They're not going to church anymore. And there's a sense of real community loss over the last half century or so.
Mm-hmm. And one of the things that we've tried very hard on this show to make people understand is that these things don't happen in a vacuum. So what are the economic conditions which led to the rise of these deaths and the use of these substances and the despair that you document in the ultimate death that led to that? What do you see in the data?
Well, globalization and automation have taken away jobs, good jobs, for people without a college degree. But that's happened worldwide. That's happened throughout Europe as well. But we're not seeing deaths of despair rise in Europe. So we had to focus on what's special about the US. And two things come immediately to mind. One is that we have this prescription opioid epidemic. So that's basically a self-inflicted wound. We started to hand out really heavy-duty opioids in Jelly Jam jars. The other thing, though, is the way that we manage and run our healthcare system, which is different from what any other country does, any other rich country does. And we think that what we'd love people to do is connect the dots, that the reason real wages have been falling for people without a college degree is because their employer, year after year after year, has to pay a higher and higher and higher premium to hire them and to fund their health insurance.
Yeah.
So that's, we think, the two causes that for us in America.
Yeah.
And talk a little bit about the intersection of race here, because part of what is uncomfortable is, of course, white people overall in this country are doing much better and able to accumulate much more wealth than people of color. And yet it seems from the data that these deaths of despair have really spiked for high school educated whites more so than high school educated other races who are also part of the working class. What is going on there, and how do you think about that?
Well, we grappled with this for quite a long time, and it's really the divide we like to make is without a four-year college degree. So even people with a two-year associate's degree are not succeeding the way people with a BA are. And the way we ultimately came to think about it was that the wheel has come around again. The first time it came around, it came for Black working class in the 60s and 70s, documented so well, for example, by William Julius Wilson, that the reason marriages started to fall, the reason out-of-wedlock childbearing skyrocketed in the Black community was because the jobs were being pulled out of the inner city. That happened, and then there was a crack epidemic on top of it. This time when the wheel came around, it came around for the white working class, and we see a lot of the same dysfunctions. People don't get married if they don't feel like one of them has a good job, but they do have children. Those children may not know both parents. There's been a real social decline, a disconnect with community. And so we feel like this is just the other shoe dropping.
Oh, interesting.
It's still the case. They don't face the kind of racism that Blacks do. But we think that a lot of the same forces are.
Yeah. Angus, could you just expand a little bit on that dynamic on the first shoe dropping? I think it's something really important for the audience to understand.
Yeah, I think it's very important to understand too, simply because it's sort of like the productive system is moving up and up and up the educational chain, as it were. So it's like the least educated people back in the 60s and early 70s were African Americans, many of whom had come from the South to live in the city centers. And those jobs were the first jobs to go away. And now it's come for the white working class with less education. And, what is, of course, worrying is that it'll move up further, so that it's people with more skills, even who are next in line. And that's a very worrying situation, especially after COVID.
And Angus, what are the policy implications? Because, if you talk to some people in this town, prior to coronavirus, they were like, everything's great. Stock market's high, GDP is growing, unemployment is low. And even within that landscape, we see so many people struggling and suffering from, despair and a loss of hope. How do you square those things, and what are the sort of policy implications moving forward?
Well, everything wasn't good before, and it's true that there were rising wages even for less educated Americans before the virus came. But there were still lower wages than at any date during the 1980s. So, we're going up right now, but we're still well underwater. Now, in terms of policy implications, I think something that Anne said earlier is a good place to start, which is, no other countries allows pharma companies to pump out what are essentially legalized heroin and addict and kill large numbers of people. That's just under control everywhere else. No one else does it. There's no reason why we should do it. So we've got to get a much tighter rein on that. The second thing is that no other country finances health insurance the way we finance health insurance. And that is a self-inflicted wound. I mean, our health system is incredibly expensive, and it's also paid through employment. And so the fact that it's like a poll tax on employees, on employers, and that's eating wages and it's eating jobs. So most large corporations they've shed all these jobs for less educated people, like food service workers, like drivers, like security guards, like mailroom operatives, cleaners and janitors. They've all been contracted out to supply companies, and those used to be good jobs, often starter jobs, and they're just gone for less educated people.
Yeah.
So that's really a tragedy, and it's something that we can fix with policy if we get any number of healthcare reforms.
Well, very important point. Thank you so much to you both. Your work has really informed the way that Crystal and I think, and many others here in Washington, so we very much appreciate it.
Thank you very much.
Thank you.
Stay safe.
We'll have more Rising for you after this.